So you're caring for someone that recently had a brain injury. What are some things that you should be aware of and things you should pay attention to? Well, the first one is a brain injury doesn't just affect the patient, but it affects those around them. And we often don't think about the caregivers, but the impact on them is just as important. And there's something called caregiver burden and even burnout. That means that when we care for someone we love, we oftentimes don't really think about ourselves, but it impacts us in a very meaningful way. It can impact us in regards to our sleep. We oftentimes find ourselves not sleeping as well, sleeping much less, or even have disturbed sleep, or it's difficult to fall or stay asleep. It can impact our appetite or eating habits. We start eating less frequently, or even eat less nutritious food. Our mood may change. We may be more irritable and have fluctuation of mood that's not typical for us. And then sometimes we even start experiencing signs and symptoms that look like we're also experiencing some of that change that the individual has had, such as experiencing things like fluctuations in attention and memory. They're not secondary to the injury directly, but to the caregiver burden that's part of it. So what are some things that we should be doing if we are caring for someone? Well, the first thing is knowing when to ask for help and assistance. Oftentimes as caregivers, we think we're the only ones that can care for our loved ones, but there's other individuals and other resources in our community that can help us out and make sure that that burden is shared. Consulting with specialists, and that goes from the treating neurologists, physiatrists, and general care doctors to mental health providers that are oftentimes not even thought of in these situations. Practicing psychologists and counselors are very vital, not just to the patient, but to the caregivers involved. And making sure that we ourselves incorporate some level of normalcy in our lives, knowing that our health is what's going to allow us to care for this individual. But when we forget about ourselves, it's not that we're sacrificing in order to help this individual more, but we're actually doing the opposite. By allowing ourselves to be even more so impacted, we're going to be less there for this individual as we become more susceptible to things like getting sick and other illness. So now for March, which is Brain Injury Awareness Month, let's pay attention to brain injury, not just something that affects the individual with the brain injury, but that affects the family, the community, and those around them as well.